When we were in Biodesign for Digital Health in the fall, the need we were addressing was the stress on parents of children with special needs. When parents receive a diagnosis, they're plunged into an overwhelming experience faced with a dramatic amount of uncertainty and expenses. It is incredibly taxing on families, as you might imagine. And in order to address this problem, we are looking to support parents in 3 different ways. First, in finding care and services, second, in paying for care and services, and lastly, building community and having fun. We were really motivated to keep working on this problem in light of a lot of the needs finding we'd done throughout the course. Parents really expressed a strong need for this type of solution. And on top of that, Chris, one of our teammates, had spent the past 4 years talking to thousands of these families over the years. And that strong needs validation was, and still is, incredibly motivating all the time. And then second was a lot of interest and support from investors and mentors that are excited about supporting us in solving this problem. We knew there was a great opportunity to create a company in this space given a few different factors. One, just again, the dramatic increase in prevalence and diagnosis rates of these types of conditions mean inherently more families need support. Second, a lot of private and public sector interest in this space. There's been a crazy amount of activity in terms of investment in opening clinics and other kinds of incredible special education service companies. And of course, the government has now required every state to have financial support going to this area to be covered by insurance, which has created a lot of opportunity. And then lastly, broadly, the consumerization of healthcare. Everyone is now expecting a lot of the same level of service from healthcare that they experience in other parts of their lives, and we think this is a great way to be a part of that. Some first steps after we knew we wanted to pursue this as a company were to run a lot of experiments. We got out of the classroom, we made as minimum of viable product as we could just to make sure we were really learning from the people we wanted to serve and understanding and making sure we were building a product people actually wanted and needed so we could best serve the population we're hoping to help. When you're innovating in digital health, there's a lot more trust involved and necessary than other industries. So for us, that's meant we're needing to raise a pre-seed round to build a first version of our product. So while we can learn and not invest too much in building just yet, we want to be learning and iterating, but we want to make sure that what we're building parents can trust and is reliable and will be there for longer term. For us in this pre-seed stage, it's really important to us that we are working with investors who have a lot of empathy for our user base. So we've largely been partnering and working with investors who have a personal connection to autism, and that's meant a lot to us, both in terms of learning and also in terms of how we think about our business model going forward. My biggest piece of advice for anyone looking to take their ideas forward would center around staying motivated, remembering why you're doing what you're doing, keeping those anecdotes and stories around in your space as you're working day to day, because there are going to be really high highs, but there also will be low lows, and making sure you remember why you're doing what you're doing and have a great team around you to keep each other motivated and supported is just so important on this journey.